Hi all, good morning to all. Today we will be dealing with colostomy care. Okay, first we will go to what is colostomy. See, colostomy means a surgical opening that is made in the colon to shorten, to remove damaged part and cut the end to divert it to an opening in the abdominal wall. So, if there is a damaged part or non-functional part, we will be removing it and we are bringing one portion of the intestine to the abdominal wall. So, what do you mean by colostomy care? Colostomy care means we are providing care to the pouch, to the stoma, and to the skin around the stoma that require a continuous care and maintenance. So what are the purpose for this? To maintain the integrity of the stoma or the peristomal skin, okay, to prevent infection, to promote a general comfort and positive self-image of a person, to provide clean to the ostomy pouch for fecal evacuation, to reduce the odor from overuse of old pouch. So what are the indications of colostomy? I tell you before, if a part of the colon is not functioning, that is the time we are doing ostomies, right? So maybe birth defect, inflammatory bowel diseases, injury to the colon or rectum, partial or incomplete intestinal or blockage, intestinal bowel blockage, rectal and colon cancers, wound or fistulas in the perineum. So what are the types of colostomy? Usually the types of colostomy, according to the duration, it is divided into permanent colostomy, temporary colostomy, okay? According to the stoma site, which is situated in the colon, it is divided into ascending colostomy. See, you can see here, transverse colostomy in the upper portion, descending colostomy in the lower portion. According to the location of stoma, as we see before slide, ascending colostomy is located in the right side of the abdomen. Transverse colostomy is located in the upper abdomen or either in the middle of the abdomen. Descending colostomy is located in the lower left side of the abdomen. Next is the assessment. The assessment part deals with the size, color, and more. So we will see first of all the size. The size should be round or an oval shape. Round measure using the stoma measuring guide we have, and oval will be measured with the length and the width or breadth. Next is color. Color of the stoma. If it is red, it implies or it represents adequate blood supply. If it is pale, that means obviously low hemoglobin. If it is dark red or purple tint, it indicates bruising. Okay, gray or black indicate there is no blood supply or necrosis. Others means appearance of healthy, shiny, moist. Next, assessment of peristomal skin. That means the skin around the stoma. So if it is looking healthy, that means there is no skin difference to the stoma as well as to around the skin. When it looks erythema, if there is a presence of erythema, what is the color? It will be red. If it is bruised, it will be purple to yellowish color. So what is the integrity of the skin? Integrity means if there is a cut or if there is no continuation of the skin, that is called integrity. So what is the integrity? If it is intact, there is no breakdown in the skin. Macerated means if there is continuous moisture to the skin become more fragile and white friable skin. That is called macerated skin. Okay. Next is erosion. Superficial skin damage is called erosion. Rashes and outbreak of the skin integrity is called rashes. Ulceration, a wound through the dermis layer is called ulceration. Okay. Now, we will check for the turgor. If the turgor is good, there is good elasticity. Check for the weak flabby skin. Okay. Next, assessment of the stoma. This is the important part. The stoma color should be assessed. If the stoma is normal, usually the color will be pink, red, and it is very warm to touch. If it is abnormal, what is the color? It will be black, dusty, pale, and it has sloughs. Now, the skin. The skin should be assessed in the postoperative period. Actually, immediately after the postoperative period, the size will be more when compared to 6 weeks after the surgery. Okay. So immediately after the surgery, it will be quite swollen and it will be big. After 3 weeks, it will be fitting. Abnormal means any sudden or unexplained swelling over the site, it will be abnormal to the stoma. Next is bleeding stoma. See, immediately after the surgery, there will be an amount of bleeding. We can assess if there is an excessive bleeding during the cleaning, or there is excessive blood in the pouch, that indicate abnormality. Pre-procedure care. See, pre-procedure, like any other procedure, you should have a detailed history taken for the patient. Current complaint, history of illness, past medical history for any comorbidities like diabetes, hypertension, heart disease, any surgical histories, and also the social and environmental histories. Then regarding important thing, that means whether the patient is having any medication or any documented allergies. Procedure. Measure the stoma if the ostomy is new, or measure the stoma if it is previously cut pattern. Then place the pattern on the back of the stoma bag. Draw a proper size opening for the stoma. Do not cut more than one bag for next ostomy change if the stoma is still shrinking, right? So if the stoma is shrinking and still on the process of healing, so don't cut for another bag. Okay, place a finger inside the bag to prevent cutting through the bag. Okay, when cutting the hole into the wafer just fit around the stoma in order to minimize the skin exposure to the stool. Okay, should not apply the wafer too much to the skin. Is left exposed to the, as we tell before, it will be make sure that stoma is having less exposure to the stool. Okay, empty the content of the bag. Remove the old bag and stoma wafer by using adhesive remover. Gently pull out the bag. If you make hard pulling, then it will loosen the skin also. So the skin may look dark pink when the bag is removed first, and it will be fade quickly. Discard the bag. Put the bag in a small baggage before putting in the trash. Pat the skin of the stoma with a gauze piece, which is soaked in normal saline. Inspect the skin for the signs of rashes, irritation, as we told before. Do your assessment for the color, integrity, everything. When skin is clean and dry, apply all the warm wafer and then gently rub it between the hands to help the wafer mold into the skin. Okay. Touch the skin around the stoma, reapply the skin. Apply warm moisture, and they don't make more sticky over the skin. Take the paper off back of the wafer and then place the bag around the stoma. Gently press the bag in place without your hand to help the wafer mold around the skin. Okay. Smooth out end of the bag, fold it 2 times and put on the clamp if the bag does not have any Velcro closure. If the edges of the wafer are not sticking to the skin, rub the skin paper prep on the edges of the wafer. Use mesh tape to tape the edges of the wafer. What health education you will be giving to the patient means assess for the color change for the stoma. Most commonly, if it become black, dark green, okay? If there is any bleeding, if there is any obstruction can be assessed by means of blockage of the ostomy by stool. So warning signs and complications. The warning signs and complications include bleeding from the stoma, bleeding from the skin, changing of bowel pattern, change in the stoma size, increase in the temperature. And the most common complications include leakage, prolapse, obstruction, stenosis, and the stoma is becoming edematous and enlarged. So that's all. Thanks for watching.